Dr. Tracy Page, and welcome to Health Made Easy, where we discuss topics focused on hormonal health, weight loss, and wellness. Yes, you heard me. I want to make being healthier easier. Don't get me wrong, we all have to do the work, myself included, but let's make being healthy less complicated. I'll provide clear, simple, and actionable steps that you can implement into your daily life. Really, who doesn't want to feel better? If you're ready to increase your energy, optimize your well-being, and restore your health, then listen up. I love helping my patients and listeners optimize their health and clear away the brain fog, shed the excess weight, improve their mood, and really change the way they age. I am a triple board certified physician, and I created Health Made Easy just for you. Let's get started on today's topic. Welcome to episode number 2. And today we're going to talk about hormones. There are actually 3 specific hormones that we're going to focus on called estradiol, progesterone, and testosterone, both free and total levels. But before I start, I want you to know that your hormonal response is as unique as your own fingerprints. Really think about that. Your hormonal response is as unique as your own fingerprints. So that means that today, when I record this podcast and I talk about estradiol, progesterone, and testosterone, I'm talking about something different for every single person who is listening to this podcast. So you may wonder, well, if that's true, then how is it going to help me? But there are some underlying important concepts that all of us, women and men, need to know in order to make sure that their hormones are optimized and also that your hormones are in balance. Because if you're anything like the patients I see in my office, they come in with a plethora of symptoms that tell me right away their hormones are not balanced. Now, again, today I'm talking about 3 sex hormones: testosterone, estradiol, and progesterone. But there are other hormones that also contribute to whether or not your hormones are in balance or unbalanced. And so today we're going to focus on these 3, but I promise you we're going to get to the other ones as well. Okay. Again, I want to give you bite-sized pieces of information so that when you leave the podcast after listening, you can take that information and you can use it to take an actionable step to create a result. Okay. Also in this podcast, we're going to talk about what labs, there are 10 of them, that all of you should have tested. Even if you're a man, there's only one lab on here that's specific for women, but everything else applies to both men and women. And there'll be my 5 bare minimum labs to have tested. So you'll get those, but you'll get also all 10. All right, so let's get started. The other thing I want to tell you, and this is specifically for women, so I don't know how many women know this, but perimenopause, when you start changing, your ovaries start slowing down, can happen as early as is in your 30s. Now, you younger ladies who are listening, don't turn off the podcast just yet, because you may have hormonal imbalance. You may have polycystic ovarian syndrome. You may have infertility. You may have weight that you can't lose. You may have menstrual headaches. You may have excessive bleeding during your menstrual cycle. And all of those are signs and symptoms that your hormones are not balanced. So please take a listen because this information does apply to you too. Okay. Now, the normal age to go through perimenopause, like I said, can happen in your 30s, and the age range is 35 to 55. And cycling after the age of 55 does increase a woman's risk for breast cancer. So if you're a woman over 55 and you're still having a cycle, then you need to check in with your doctor. Okay. Hormone replacement should not be considered without a thorough understanding of how the hormones work in your body and how they interact with each other. So today we're not talking about hormone replacement. I will do a separate episode on that, and that will apply to women who are going through perimenopause and menopause. But today, again, it's just educational purposes on 3 main hormones: estradiol, progesterone, and testosterone, and what 10 labs every person should have checked to make sure they understand whether or not their hormones are in balance. Okay? Now, let's talk about some symptoms that you could be experiencing to say, does this really apply to me? So if you're having, like I said, headaches during your menstrual cycle, if you're not having a menstrual cycle, and you should be, and you're not on a birth control pill to prevent it, if you're having mood swings, increased anxiety, if you can't sleep at night or you have trouble staying asleep at night, you've lost sexual interest, you notice that you have indigestion, You notice all of a sudden that you're having a lot of achiness in your knees, your wrists, your shoulders. You may notice hot flashes. You might notice night sweats. You could have depression, irritability. You may have nervousness. You could have decreased libido and no longer interested in sex. You might have excessive menstruation and you go through period after period using so many pads or tampons because you have excessive bleeding. These are all signs that your hormones are not balanced. Other ones can be brain fog. You could also notice weight that you can't lose or weight gain. You might have dry, thin skin, thinning in your hair, saggy cheeks, thin lips. Your memory's not as sharp. I hate to tell you, the list is really long. And I have made a list of signs and symptoms to look for in a downloadable PDF. So we will send you to the website so you can go ahead and put your information in and you'll be able to download this. And it does have important lifestyle changes that you can start implementing to help balance your hormones. So stay tuned, that's coming. Also, let's talk a little bit more about your hormones, what they are, and why do they change. So I want to start with estrogen because estrogen is a really important hormone. And if you have too much of it, it can cause, unfortunately, hormonal related cancers, and it can make it difficult to lose weight, and it can cause a lot of the symptoms that I just talked about. The other thing is there are different types of estrogen, and most women don't know this or have not been educated about this. So there are 3 types of estrogen. It's easy to remember. There's E1, E2, and E3. E1 is called estrone, spelled estrone, and will be in the handout provided. It selectively binds what we call our alpha receptor 5-to-1. So why is that important? Because it increases breast cell proliferation. And so estrone is not a hormone that we want to have a lot of in the body because it binds to the alpha receptor. However, our fat cells make estrone. And what's really interesting is that this hormone can be converted into another type of estrogen called estradiol. So estradiol is E2, and it activates our alpha receptor and our beta receptor. So think of it as a 50-50. So it can go to either receptor. And this one is the primary estrogen hormone that we make in our reproductive years. And it's important because it is one, gives us that feeling of being a woman, right? And men, keep listening, you too make estradiol, and too much of it can give you that dreaded man boobs or give you that weight around your abdomen. So it can also cause prostate cancer in men. So it's really important that we all know what our estradiol E2 level is. The third one is estriol, which selectively binds to the beta receptor 3-to-1. And why is that important? Because beta receptor inhibits proliferation, especially in the breast, so it's protective. So if you have 2 receptors and most of them have beta, most of them have E3 on them and the beta receptor is activated, that's going to be more breast protective, more uterine protective. And we make this estrogen, especially while we're pregnant. We also use this estrogen E3 when we do estrogen replacement in my ladies who are perimenopausal and menopausal. And again, I'll talk about that more later. Now, there is another estrogen for those ladies who are on a conjugated equine estrogen. So those are my ladies who are taking hormone replacement that's synthetic. And as you get to know me and as you get to know the literature, I'm not a big fan, and nor do I ever prescribe conjugated equine estrogens. They selectively bind the alpha receptor and cause potent downregulation of our beta receptor. And remember, our beta receptor is really important in preventing proliferation. So this is found in synthetic estrogen oral contraceptives, and it's also found in hormone replacement that a lot of women come in, especially if they're on oral estrogens, which again, I'm not a fan of those either because they go through the liver and they can increase clotting factors. And we'll talk about that more when we talk about hormone replacement. So estrogen is so important. We need it. It helps our brain function. And in fact, estrogen has 400 functions in our body. And when you lose estrogen, for whatever reason, then all of a sudden you start having a lot of symptoms. And that's why they show up with hot flashes, night sweats. But in my younger girls who come in and maybe they're not having a period, they will show up with dry skin, hair loss, brain fog. So it can happen at different ages and for different reasons. So I want to talk to you about how to improve estrogen metabolism in your body to prevent breast and uterine cancers. And one of the things that you need to do is you need to restore progesterone if it is low. So let's talk about progesterone because that's the second hormone I wanted to talk to you about. And progesterone is really important. Actually, it's equally as important as estrogen. And I really never knew until I myself had low progesterone. And it presented in me with a number of things. But one, I couldn't lose weight. Two, I felt bloated all the time and had excess fluid because I was estrogen dominant. And I have a whole podcast just to talk about estrogen dominance. I never was a person who was anxious. I never felt anxious, but I would have to tell you that probably in my 30s, I felt a little bit more like, I don't know how to explain it. Impatient, irritable. Those are probably the two big words that come up. Not so much anxiety, not worried like that type of anxiety, but just more impatient and irritable. I also had problems with staying asleep, and that's a sign of low progesterone. Migraines during my cycles, and a little bit of hypersensitivity. I mean, I was pretty sensitive. And I also noticed that I was more achy. So a lot of pain and inflammation in my joints, didn't recover quite as fast. And honestly, I did not have much libido, but I'm going to blame that one on testosterone because mine was 0 when I had it tested. So we'll get to that one in just a second. And then my cholesterol started to go up. And I had always been one to eat healthy, so I didn't understand why my cholesterol was changing. And all of those are symptoms of low progesterone. A lot of us don't know that. And why? What causes low progesterone? So it can be from stress. And I was in training. So I definitely was stressed. I was in medical training. I was done with medical school, but I was in training during residency. Also, too, is it can happen because you're on antidepressants. Now, I was not on an antidepressant, but that's a reason. It can happen because you just have low production. So your ovaries start to slow down. And remember, I said that perimenopause can start as early as in your 30s. And it can be due to excessive sugar intake or saturated fat intake. You can have excessive arginine, which is a protein consumption. You can have deficiencies in vitamin A, B6, vitamin C, and zinc. All of that can cause low progesterone. And also, you can have decreased thyroid hormone. So you might not be making enough thyroid. And you know what? I didn't know it. But at the time, I probably was hypothyroid. I got diagnosed later in life, but I could have been hyperthyroid, and that could have been why my progesterone was low. So those are all, or not all, but some of the reasons why we could have low progesterone. Another thing, too, that a lot of my ladies don't know that come in to see me is that they're on synthetic progestins. So that may be through their birth control pill. And what happens is it causes your own progesterone that you normally make to go down. So when that happens and you're on a birth control pill and you're having low progesterone that your body should be making, you'll notice an increase in appetite, weight gain. You'll notice fluid retention, irritability, depression, headaches. You can have bloating, breast tenderness, acne, hair loss. You can even have insomnia and nausea. And you'll notice that the fluid will stay in your body longer. Your cholesterol will start changing. And really, it just interferes with your body's ability to make its own progesterone. So personally, I'm not a big fan of birth control pills. I know that there is a place and time for them, but I think if you can balance your own hormones and use another form of contraceptive, you'll probably be better off in the long run because your hormones will be able to do what they're supposed to do, and they'll be able to be balanced the way they're supposed to be balanced. And a lot of times I see ladies in my office, especially young girls who are having really heavy menses, and they get put on a birth control pill to help control that, but that's just overriding their ovaries. And if we could actually just balance their hormones and also change their lifestyle and to make sure that they're detoxifying and they're eating healthy, then they probably don't need to be on a birth control pill. And I try to educate them on this and then give them their options and make sure that they're making an educated choice. This podcast is brought to you by Orthomolecular Products, the exclusive supplement company of the Wisconsin Institute of Functional Medicine. Orthomolecular has been a leader and an innovator in the functional medicine space since it was founded over 31 years ago. They follow the latest science and combine the highest quality of ingredients to produce effective nutritional solutions for clinicians to use with their patients. By controlling the entire manufacturing process, they know exactly what is in each capsule, and they offer products free of allergenic additives and preservatives. This is one of the many reasons I decided to carry Orthomolecular products in my office. You can book an appointment today to learn more about how my team and our partners at Orthomolecular can help you reach your health goals. Call us at 920-380-9890 or visit us on our website at wisconsinfunctionalmed.com. That's wisconsinfunctionalmed, all one word, .com. Orthomolecular products, because efficacy and your health really matter. I'm going to talk a little bit about testosterone because we're talking about birth control pills. So another thing that a lot of my patients, and now hopefully my listeners, will learn is that if you are on a birth control pill, it can naturally decrease your testosterone level. And why is that important? Well, I think you're going to find out it's majorly important for a whole host of reasons. So testosterone, we think of testosterone as a male hormone, but really it's a hormone for both males and females. Now I'm going to step back just for a second because I was talking about estrogen and I said men don't want too much. They need some. Every man needs estrogen, but they don't want too much because they don't want man boobs. They don't want prostate cancer. They don't want the weight around their belly. And I didn't say why men want progesterone. So progesterone is very calming to the body. Progesterone helps us relax. Progesterone decreases anxiety. It helps us sleep at night. Progesterone has a whole host of things that it does. It also improves your blood pressure. It helps your body use and eliminate fats. It lowers your cholesterol. It increases the hair on your scalp. It helps balance the fluid in your cells. It improves your metabolic rate. It's a natural diuretic. It's a natural antidepressant. It also promotes your immunity. It's anti-inflammatory. It helps your thyroid function well and it improves your libido. So it does that for both men and women. So it's important that both men and women have normal progesterone levels. So now let's talk about testosterone because it's just equally as important. So testosterone, how do we know that it's low? Well, first of all, you'll have no libido or very little. You'll also notice that your good cholesterol, HDL, may start to decrease. You'll have trouble losing weight or you'll have weight gain. You'll also notice muscle wasting. So I see this a lot in women. They have no ability to put on muscle. And we're not talking about Arnold Schwarzenegger type muscle. We're talking about, just firm muscles, firm arms, firm legs, firm butts. We all want that as women. We don't want to have saggy, flabby arms. And you don't have to put on big muscle, but you need some muscle for tone and definition. And if you're low in testosterone, it's very hard to obtain. You'll also notice thinning and dry hair, droopy eyelids, saggy cheeks, thin lips. You'll have increased anxiety. What's really interesting is what I see sometimes in women also is they have low self-esteem. They don't have any, get up and go. They have difficulty making decisions. They're very hesitant. When they have low testosterone, I'll notice that they are moody, that they don't have any drive, their motivation, their willpower, they're like, go out and conquer the world is gone. And so testosterone does that for both men and women. And it's really important that we have normal levels. And I'm talking normal physiological levels, nothing crazy, but that make you want to, again, go out and do the things that you want to do and get things done and also feel amazing. So those are the three hormones that are so important that I wanted to cover today. If you have low testosterone, you'll notice some of the things I just described. There are causes of low testosterone, so menopause or perimenopause, being on birth control pills, if you've gone through chemotherapy, if you have adrenal fatigue, which we'll talk about, if you're someone who deals with endometriosis, you've been on birth control pills, or even if you're depressed, sometimes you can have low testosterone, so you should have that checked. There are natural ways to increase your testosterone level, and you can do that by losing weight, sleeping 7 to 9 hours at night, getting enough rest, reducing your stress, exercise. There are 3 amino acids, arginine, leucine, and glutamine, all of which help increase your testosterone level, and making sure that you get adequate protein in your diet. And I'll go over diet and how that plays a role in testosterone at a later podcast. But today I just want to introduce these 3 hormones, estrogen, again, estradiol, progesterone, and testosterone. So now that we've talked about all 3, you might be wondering, well, gosh, I have a lot of those symptoms and I think I better have my levels checked. So I want to tell you that it's good to have these 10 labs checked just to find out where you are and to find out if they are, quote, normal or abnormal, because they could be causing some of the symptoms that you're experiencing. So I have my 5 bare minimum labs that every woman and man should have tested. And really there are 4 for men and 5 for women. So the first one is estradiol, E2, that we were just speaking about, because it's very important. It is our reproductive hormone. The second one is estrone, which is E1. Now, if you are carrying excess weight, if you are on any type of hormone replacement other than a bioidentical cream, then I think you should have your estrogen level checked, because if you're on an oral contraceptive, you can cause that to go up. And again, estrone binds to our alpha receptor 5-to-1, and that causes proliferation, which we don't want in the uterus or the breast tissue. Additionally, if we're overweight, estrone is produced by our fat cells. And again, it's not the estrogen of choice that we want in our body. And also, too, it just tells you, are you really getting rid of your estrogen appropriately? Because if that number is super high, then it tells me that you may not be detoxifying well. The third hormone that you should have tested is testosterone free and total. And the reason I check free and total is because we have a total amount of testosterone in our body, but part of that testosterone is bound to proteins, things like the sex hormone binding globulin protein. And why that's important is because if that testosterone is bound to a protein, it's not available for use. So you might have a high number in your testosterone total, but you'll have very little available for use. And so therefore you'll have a lot of those symptoms that we talked about when we talk about testosterone deficiency. The fourth hormone to have tested is progesterone. And again, for both men and women, it plays a super huge role in how we feel, how we deal with anxiety. It's very calming. It helps us sleep at night. It balances estrogen. And for my female patients, it's one of the most important balancing ratios that we're going to talk about is progesterone to estrogen ratio. So it's very important to have that one as checked as well. Now, the fifth one, that's the bare minimum to have tested in women, is FSH if you are over 30 and you're having any of the symptoms that I described, because FSH is called follicular stimulating hormone, will tell us where you are in the perimenopause to menopause pathway. So if the number is 0 to 10, then that tells us you're still having ovarian function and it hasn't really slowed down. But if that number creeps up over 10, that tells me your ovaries are slowing down. And if it is, as it goes higher, that's the slower the ovaries are going. So as FSH gets over 60, then we know that your ovaries are no longer producing hormones and just your adrenal glands are. And therefore, you are in menopause. Okay. Now, menopause is described as 1 year cessation of menses. And we'll talk about that deeper in another podcast. But again, FSH gives us a objective number to tell us where you are along that pathway. Now, the other 5 hormones that you can have checked if you want a complete panel is pregnenolone, which is the precursor to progesterone, and we call it the mother hormone because it's the first hormone we make after cholesterol, and all of our hormones are made from cholesterol. Then I also check a DHEA, again, DHEA, the high sensitivity type lab, because it is the precursor to testosterone. And DHEA is made in the adrenals, and it helps balance out cortisol and gives us really a sense of well-being. It's such an important hormone. It gives us energy. So I check that one as well. And then I also check a hemoglobin A1C. This lab is done fasting because it gives me a picture of your blood sugar levels over the last 3 months. It will tell me what your average blood sugar is, and it will tell me if you're pre-diabetic or even diabetic, which is really important because, again, I told you that although we are talking about sex hormones today, there are many hormones that play a role in balancing out how you feel. Now, there are 2 more, high sensitivity CRP. So the lab is CRP, and I do the high sensitivity one. And that gives me an indication. It's a general marker of inflammation. And this is very important because if you're inflamed, it doesn't matter how hard we work to balance your hormones. If you have inflammation through your body and we don't address that, then we're never going to get you feeling better. So you always want to know what your CRP is. And then the last one is your salivary cortisol. Now, I like testing salivary cortisol because it gives me a snapshot of what you are first thing in the morning, your cortisol level is, what it is before lunch, before dinner, and then before bedtime. And cortisol, I'm going to do a whole podcast on adrenals and cortisol and DHEA and stress because it deserves its own podcast. But again, cortisol, you'll hear a lot about adrenal fatigue. And really, that's just a label that maybe your adrenals are not working at their maximum functional ability. And that's because lifestyle. So maybe you're stressed, you're burnt out, you're burning the candle at both ends. And so really that lab just really tells me more about your lifestyle than anything, and then helps me help you. So I think that these are the 10 most important labs that everyone should have. And again, they include estradiol, E2, estrone, E1, testosterone, free and total, progesterone, and then FSH if you're a female. And then the other ones to be added include pregnenolone, DHEA, salivary cortisol, hemoglobin A1C done fasting for at least, I think it's 9 to 12 hours. Our labs are at least 9 hours. And then CRP. Now, here are some more important things to know. If you're cycling and you're having a menses, you should have your hormones tested at the 3-week point of your cycle, day 21. And for counting purposes, you want to count the first day that you start bleeding as day 1 and then count up to day 21. But it could be anyway from day 19 to day 21. The earliest is day 19, but I say 19, 20, or 21 to have those labs tested. And then if you are on birth control pills and you have your labs tested, just remember that the numbers that you get are a reflection of your birth control pill, especially for estrogen and for progesterone. Now, your testosterone level will be a true indication of what your testosterone level is, regardless of being on birth control. And birth controls can cause testosterone to go down. So if you're on birth control and you're feeling brain fog, lack of energy, motivation, you notice that you're gaining weight, then you may want to have your testosterone level checked. Now, what can you do? What kind of lifestyle changes can you make to help balance your hormones without ever having them tested? And these are the things that I tell my patients to focus on because we're always about food first and lifestyle. So important lifestyle changes include getting enough good quality protein. And your protein can come from meat sources or plant-based sources, but you want to make sure you're getting enough protein. And I usually tell my patients, take the number 0.8 and times it times your ideal body weight. Well, first take your ideal body weight. Let's say your ideal body weight is 150. So you'll take your ideal body weight, 150, and you'll divide it by 2.2, and you'll get 68 kilograms. And then you want to times that times 0.8, and you'll get 54 grams. If you round up, it's 55. So you want 55 grams of quality protein in your diet to help make sure you have good balanced hormones. You want to avoid sugar and refined carbs. Now, again, I'm all about lifestyle, and we're going to talk about diet and weight loss coming up. But I would just say if it's real food, eat it. It's much better to have a handful of grapes than it is to have a handful of M&Ms. Now, there are days you're going to have a handful of M&Ms, and that's okay. But I would say avoid sugar and refined carbs, especially if you're experiencing any of the hormonal symptoms I spoke about earlier in the podcast. Try to get some regular exercise. It's so important, and you do not have to kill yourself. This is one of the hardest things that was for me to learn, but one of the greatest benefits I ever got when I finally learned it. So I used to be that person who had to go in for a certain amount of time, do a certain level of intensity for a certain number of days. And it was always like kind of chasing that goal, the carrot on the stick. And as soon as I said, you know what, I'm giving myself 10 minutes. If I'm feeling it, I'm going to continue. My goal is 30. If I want to walk, I walk. If I want to run, I run. If I want to cycle, I cycle. If I want to do a class, I do a class. I didn't really give myself all these constraints. I just said, just go have some fun. And as soon as I did that, and I sometimes only exercise for 30 minutes. I try to do it every other day. Sometimes it's 4 times a week. Sometimes it's 6 times a week. Sometimes it's only 3 times a week. And that's okay. The most important thing I'm going to teach you is consistency trumps intensity every time. So if you're consistent, some days you'll be more intense, some days you'll be less, but the most important is consistency. So put on your tennis shoes, go outside, it costs you nothing, go for a walk, listen to a podcast or your favorite book or some music or go with a friend. I just had a walking meeting with a friend. We were having so much fun. We walked for an hour and it went by so fast. I mean, like an hour and 15 minutes. So go have some fun, go walk with a friend. It's not about hitting a number or hitting a level of intensity. It's about just caring for yourself and making some time to give back to your body and to move your body. The other thing is practice stress management. So like I said, I have a whole podcast coming up on your adrenals and stress, but you got to find a way to manage your stress. You know, stress comes in every day, and if we don't have an outlet, it just piles up, and pretty soon it's really going to affect your health. You know, I think it's one of the number one drivers of disease is stress. So you got to find your way, whether it's meditation, whether it's dancing, it's music, it's walking, it's exercise, it's sitting down with a book, it's being with friends, but you got to find a way to manage your stress. The other things I would say to you is when it comes to food, use quality, healthy fats, olive oil, avocado oil, walnut oil. Those are probably my favorites and my go-tos. So I would say consume really good quality fats because the other ones are not good quality. They're not good in the body and they can oxidize and that causes health issues. And eat foods high in fiber, especially when it comes to hormones. We're going to talk so much about fiber and the goal to get 30 grams of fiber a day. It's a lot. And I'll teach you one of my tricks that I do is I do 3 tablespoons or a fourth a cup of chia seeds in my smoothie, because a fourth a cup is 20 grams of fiber right off the bat. So I try to get that in every day because my goal, just like you, is to get 30 grams of fiber. And it's a lot of fruits and vegetables because you're going to be surprised they don't have as much fiber as we all think. So eat foods high in fiber or do things like smoothies with chia seeds. That's another way to help balance your hormones. And then finally, consistent, high quality sleep. And I will, yes, do a podcast on sleep because we all struggle with sleep for various reasons, but it's one of the most important times that we rehab. It's one of the most important times that our body starts to repair itself. Our brain starts to remember things. Our whole body just resets when we sleep. And so it's so funny. I have a quick story to tell you. When I met my husband and we were dating, he needs far less sleep than I do. So I had him draw a pyramid, like 4 little bars. And I said, write out your most important things. And at the base of my pyramid, when I met him, was sleep. Now, starting my own practice, starting a podcast, an online weight loss program, caring for patients, sleep has not really been on the baseline of my pyramid lately. And my husband, he always reminds me, I thought sleep was the base of your pyramid. And it honestly is. And I've just been going on adrenaline. I've been so excited about everything that I'm bringing out to the world to be of service. But I will tell you, it caught up with me. And so last night I did have 9 hours of sleep and it was the best night ever. So please, please, sleep, just like stress management, is one of the most important things you can do to help balance your hormones. I promised I'd keep this at 30 minutes. So that's all for now. And next time we'll talk about, let me see here. Our next podcast, I believe, is going to be either about sleep or it's going to be about stress management. And I'm pretty sure it's stress management. So take care. I hope you'll implement at least one of these suggestions. Go get your labs done. Know more about your health. You can change the way you're aged. I promise you. Talk to you later. This is an important reminder. The podcast is for educational purposes only and is not a diagnosis or a prescription for care. Please consult with your healthcare practitioner before moving forward with any of the therapies or treatments discussed in today's podcast. If today's topic resonated with you and you want more information, please check out our website, wisconsinfunctionalmed.com. All one word, wisconsinfunctionalmed.com. Also, for those of you who want further assistance with weight loss, consider our online weight loss program called The Pause, which can be found under services. We really focus on helping you reach your weight loss goals. We provide a supportive and interactive and engaging environment, which is led by me, Dr. Tracy Page, so you can get all the help you need. Remember, you can change the way you age, and I'm here to help.